Before I show you how to adjust the spine, one of the things I want to teach you is the tissue pull. And so let's just act as if this person has a lot of hair. You always want to do everything in the same motion. So one of the things I do is I like sweeping this way and taking the earlobe, the bottom of the ear, and just pull it. You see how the tissue pulls? And so now when I do that, I take my chiropractic index finger and I palpate off the mastoid just till I feel it shift right off into the soft tissue, go a little bit more inferior, and right there is the transverse process. Here's one of the big mistakes, is a lot of people will palpate, they'll either get too close to the mandible, and if you do, you get right in between there, and that's the styloid process, and boy, you can trigger a coughing reflex. Some people adjust near there and they'll break them off. Just know how to palpate. Again, sweep, palpate straight down, there it is, and the tissue's pulling. You can see that. That's why my dot is moving, because I'm pulling the tissue. But as I come down this way, there's it. So now I take my index finger and switch it. See how I never stop with the tissue pull? Sweep, drag down, make your contact, switch fingers. Now palm up and roll right on top of the nail. Palm up, roll, and make your contact. Again, understand that when you do the tissue pull and you roll your hand in, that contact hand, the nail hand if you will, should not move. If it moves, you're going to slide off your point of contact. Don't do that. Once you roll in, you're on, don't move. Now your hammer hand, that one is going to set up the plane, if you will. I'm going to go over that right now of how the atlas angle is. Remember, I said the right elbow should be on one side and the left on the other, and they're matching the plane. If the atlas has shifted this way, then why wouldn't I put my arms, left elbow, right elbow, in matching the same plane? I think of it like if I were to lay a long yardstick across here, my arms should be on this plane, not this plane, or not this plane, and not over down this way, not standing above. No, I want to match the plane of how the atlas is shifted, the shape of the atlas. So I am becoming one with that bone as it's moving this way. Now, roll up the tissue pull, as I just showed you. Slide your contact, switch. Now watch my elbow. The elbow is important. I come down low, rotate up, and I drop. My elbow doesn't move. That's the plane. Anterior tubercle. The other hand opposes that, matching that plane. Doesn't come up high, opposes it, and my episternal notch, now my notch can be above or it can be below, depending on the line of drive I want to have. But when I do that, notice my arms should not shift, because that's where I can stand over here, doesn't matter. My head can move, my shoulders can move, my elbows never move, because I want to match the plane of the atlas. What's so interesting about adjusting the spine and understanding the intention behind the adjustment is to truly understand the mechanism of the toggle recoil. And the toggle, of course, is the arms, the toggle, and the recoil is the atlas. I'm going to explain that to you. And this table, this side posture table here, this mechanism came out in 1951. And it came out in 1951 because this guy named Thompson went up to this other guy named Palmer and said, hey man, I have a cool idea. And they invented the PTA table, Palmer-Thompson Adjustment Table, part of the HIO work, hole-in-one that is. The atlas, as unique as it is, sits in a certain position. But before we talk about the atlas, the setting up of the spine in the proper fashion is absolutely imperative when it comes to this adjustment. Foramen magnum, or the occiput itself, should be flush with the table. Therefore, the table and the skull, the head if you will, act as one unit. See how they move as one unit? Your shoulder sits further down, so therefore it's like sleeping in your side, nothing supporting the neck. The atlas vertebrae, as it rests sitting in this abnormal position, again, you know that because of the neurologic exam and all the other exams that you do, but once you've confirmed the misalignment, let's just say that this person's spine is subluxated to the left-hand side. And so now the atlas, as it sits in this certain position, there's got to be a way of shifting this bone that leaves really no pain and no discomfort. The adjustment should be an invitation to innate. And so now, as this moves, what you want to do is elevate the head on the table here. So what I mean, the table is elevated, and you shift this bone according to the misalignment on the x-rays. So the vertebrae can be sitting in a certain plane, therefore your hands and your arms should mimic that. But when I shift that bone, what happens the instant that bone begins to shift, let me move my hands, the instant that bone begins to shift away from its subluxated position and unlocks, if you will, as soon as it's about to unlock, the head is going to follow it with a drop. And when it drops, that bone then unlocks and recoils until innate decides where it should go. Toggle joint, unlock, recoil. Now, once that vertebrae is seated in a proper position, we have no idea where it's at. Innate puts it there. We get the client on up and we have them rest. And have them rest to allow the muscles to adapt to the bone's new position. There's no twisting, popping, snapping, or cracking. Again, the adjustment is made on the transverse process because it's a much easier plane to move that vertebrae. You don't want to contact it back here or back here. You don't want to do that. In the event they're missing a transverse process, then yeah, that would be your only point of contact. But transverse process is the way to adjust, and the only way I feel to adjust properly, side posture toggle. All right. So the point of the adjustment, of course, as you know, is to unlock the vertebrae and let innate do her thing. But remember, the atlas moves in a certain plane, so there's got to be a torquing motion. This is why when I rolled in, you see my elbow's low, and I roll up this way. Depending on if the atlas is really, really high or really, really low, superior, inferior, as it's sitting in a certain plane, my roll-in is going to play as such. This is why films are so important. CBCT, x-rays, get something so you can see it. Not to see is to guess. But there's a torquing motion. And that torquing motion, as you can see, my arm move, but my hand's not moving. Right? That's an art in this, and you have to practice that. I'll show you how to do that. You place both hands on the table, and you want to act like windshield wipers. Right? They both position together. Your arm should do the same. See this? And so what you want to do is start rotating your elbows. Just rotate your arm. And you just do this and do this. It's a muscle memory. The more you do this, the easier it'll be. It's like driving a car with stick shift. And so, again, rotate. See how they're acting like windshield wipers? It's really, really important. Now what you'll do is you'll start to use your fingers on the table. And then maybe 2 fingers on the table. And then 1 finger on the table. And then eventually, you won't need one. And you'll just get that. Again, it's a nice, why is that important? Because when I thrust, that torquing motion, we are the toggle. The atlas is the recoil. Toggle, recoil. HIO. That's how it works. All right. So now when I do this roll in, right, when I palpate, do my roll in, and I roll right here, I pick up the table. Remember, I oppose my opposite side, and when I adjust, it's this motion. The torque motion comes on down. So it's this motion. So watch this. When I do this here, maybe I'll switch side. It might be easier to see. Let me do this. And so when I do this here, and I torque. Now watch. When the table's elevated, I'll do it a little quicker. See that? And you shouldn't, a lot of people, if it hurts, you're using your triceps. It's a pectoral flex along with the tri at the same time, but it really comes from the pecs. It's just an impulse. And you set that in motion. And now if I were to do it the right way, if I set that, see that? Set it, pose. And so the right hand is what does that force. So, I'm sorry, the left hand is your hammer hand, right hand's your nail hand. And so as you sit up this way, this hand should not do, remember, it's just making a point of contact. That one is the one nailing it down. That one. So now when you thrust, this one will come off and do the torque, and this one does the pressure. Pressure, torque, toggle. That's how it works.